calendar, I will be giving a speech on the dangers of parvovirus and hopefully persuading more pet owners to vaccinate their dogs and puppies against parvo. As an animal hospital exam room assistant, I see a lot of cases of parvo. Walking into an exam room with a 14-week-old puppy, knowing the symptoms are vomiting and diarrhea, it's hard. What will happen is you can almost smell the diagnosis before you walk into the room. When you do walk into the room, the patient doesn't even lift his head. Vomit has crusted the fur along the mouth into this ugly yellow color. Bloody diarrhea has completely matted the fur on the behind. And you almost don't even need to run any testing because you almost know what it is without it. But a positive snap test confirms it. It's parvovirus. Parvovirus, as described by the book Common Diseases of Cats and Dogs, is described as a small, non-enveloped, DNA-containing virus. Many mammalian species have a parvovirus, but it's species-specific, which means humans cannot contract canine parvovirus. According to Dr. White of Lone Mountain Animal Hospital in her video, canine parvovirus is increasing in prevalence here in southern Nevada. It is highly contagious. It is shed through the feces of infected dogs. The highest rate of contamination in the feces occurs in about the first 2 weeks. But the virus can live in the environment for months to even years because it's very, very hardy. Only a small amount of the feces is needed to infect an unimmune dog. It's transmitted through the oral nasal exposure, which means dogs have to sniff, lick contaminated feces. It can also be transmitted via people, grooming supplies, veterinary supplies, insects, and even rodents can transmit it to new locations. It's nearly impossible to disinfect. Most viruses have a fat layer surrounding them. Fat layers are easy to break down with common soaps and detergents. But parvovirus isn't built like that, which makes it very hard to get rid of. Only bleach can really get rid of it, and it doesn't truly get rid of it, it simply reduces the number of the viruses on the surface. Attempting to shield a puppy from exposure is completely futile, according to veterinarypartner.com. Upon infection, the incubation period is generally between 7 to 14 days, but it can be as little as 4 days in some cases. The Book of Infectious Diseases of the Dog and Cat elaborates on the infection process. It causes the symptoms of vomiting and diarrhea. It can kill in many different ways. One of the ways it kills is through metabolic derangements. It takes all the fluids out, losing them by vomiting and diarrhea, and that causes severe dehydration. Dehydration can kill. Another way that it can kill is through the bacterial invasion of the bloodstream. The parvovirus primarily affects the small intestine. As it breaks into the small intestine, it can eat through the intestinal wall and infect the bloodstream, causing sepsis. The immune system is completely unable to fight back because one of the first things parvo does is it affects the bone marrow, which produces white blood cells, eliminating the immune system's way of fighting back. The virus is often fatal. There really is no cure. So far, there is no way of completely eliminating the parvovirus. Right now, there's only treatment. Treatment's goal is to control the symptoms. It can't cure it, but it can control the symptoms. How it controls the symptoms is restoring fluids and fighting bacterial infections. Best way of doing that is through hospitalized care with IV fluids administered 24/7, as well as IV antibiotics. Because with vomiting and diarrhea, puppies given oral meds, they just don't keep down those oral meds. The sad part is, hospitalized treatment can cost between $1,000 and $3,000. It's not cheap, it's expensive, and there's no guarantee the puppy will actually survive. The best way to prevent parvovirus is to vaccinate against it. Vaccines produce an immunological response by injecting a modified version of the virus into the puppy. The immune system sees the virus and they respond to it, producing the antibodies required to protect them from the virus. Vaccines should start when the maternal antibodies begin to fade away. Once they're about 8 weeks is when that drop-off occurs. So that's when the first parvo vaccine should occur. But puppy immune systems are similar to puppies. They have short attention spans. So boostering them at 12 and 16 weeks helps remind the puppy's immune system that they need to produce these antibodies. In adult dogs, the immune system is more mature and they only need annual boosters. Holick and Carmichael's article regarding maternal antibodies and their response to vaccinations further goes into the timeline of the maternal antibodies going from the puppy immune system and when the vaccine should actually be started. Vaccines aren't perfect though. Some dogs' immune systems overreact to the vaccines. They can cause vaccine reactions that mimic the virus itself. Vomiting and diarrhea can occur, as well as lethargy and sometimes even death. But the benefits of vaccinating your dog or puppy against parvo outweigh the risks. Vaccines cost a mere fraction of the cost of treatment for a dog infected with parvo, and it can protect puppies from contracting the disease in the first place. That's it. Thank you.